Hey y'all, welcome back to Breathe Easy. Today we're talking about something that sounds charty, but it's actually straight up patient safety. ETT Securement documentation. And I brought my favorite kind of guest, someone who actually did the work behind the scenes. Zach Colton is here with the why, the what, and what does this mean for me at 2 a.m.?
Hey everyone, happy to be here. This is about correcting documentation to be able to monitor trends to prevent problems that we all hate dealing with.
So Zach, before we talk changes, answer the question everyone's thinking. Why are we messing with the flow sheet at all?
Because right now we can't reliably document or track commercial ET tube securing devices actively in the EHR, and what that means, we can't see patterns. The purpose is simple: improve documentation and tracking so we can support quality improvement and reduce unplanned extubations.
So translation, we're building the chart so it actually tells the airway story so we can protect patients and improve practice.
That's right.
So let's paint the picture. What is the gap you're seeing right now?
Current EHR flow sheets don't provide a method to document or track activity involving commercial ET tube securing devices. So if we were to actually look at our flow sheet right now, we have no way of being able to actively tell if we're documenting correctly or being able to follow when a device is being changed between each assessment. The lack of documentation limits visibility into device-related practices and prevents effective trend analysis and improvement efforts.
So we're doing the work, but the chart is basically just shrugging, and we need to chart to stop shrugging. And this wasn't just some random idea. Where did all this come from?
So NICU assembled an unplanned extubation team to identify the need for standardized documentation, specifically to capture commercial device activity like retaping, repositioning, and device changes. Adding clear, structured fields lets leadership and clinical teams monitor best practice compliance and identify opportunities for improvement.
Which is exactly what we want, right? Less guessing, more improvement, fewer "how did this happen" moments. So let me say this out loud for the people in the back. This is not, "Hey RT, here's 10 more boxes to document."
Right. The assessment is that we can simplify the airway documentation groups while adding targeted fields that track ET2 maintenance. The goal is consistency, clarity, and better reporting accuracy for airway device practices. This also, if you look at the information that we sent out in the email, hopefully the workflow is improved and it actually flows a little bit easier for our documentation during our assessment.
So less clutter and more meaning. That is a whole vibe. Let's get into the actual changes. First one, words matter.
We're updating ET tube secured at centimeters to ET tube secured depth centimeters. Same idea, clearer wording. And we're standardizing ET tube secured at, which are ET tube securement landmarks such as teeth or gums, has been moved for closer proximity.
So when everyone documents the same language, everyone understands the same story? So what are we removing, Zach?
We're removing ET tube neobar and ET tube repositioned as standalone rows. That helps simplify the selection and avoid duplicate or unclear documentation.
This next one is big. Tell us all about the holder type, Zach.
ET tube holder type becomes a drop down with commercial neo, commercial adult, or commercial tape. This will allow for a more accurate documentation on which kind of securement we're providing for the ET tube.
So we can actually see what we're using now instead of trying to decode free text charting like it's a mystery novel. And Zach, what about the status?
ET tube holder status will be a dual select drop down, which means that you can select multiple options, and your options are changed, repositioned, and retaped.
I love this because it captures the work, not just there's a holder, but what did we do with it? We're getting rid of the noise, so what actually makes sense when we're charting at the bedside. What's up with this reason for change row?
That's the clinical story right there. That's how we find trends and fix problems before they become harm. Reason for change row is a drop down that includes loose tape, skin breakdown, tube migration, and recommended change out.
quick sanity check. What stays the same?
So the rows that are going to stay the same will be bite block in use, cuff pressure in centimeters of water, airway site integrity, and chest x-ray reviewed.
Love that. Keep what works and upgrade what doesn't. And we have a quick units glow up too, right?
Yeah, it's actually kind of funny because our old ET tube cuff pressures millimeter of mercury didn't actually say millimeters of mercury. It said mmg Hg, so it's been updated to have the correct terminology to actually say millimeters of mercury.
Tiny change, big clarity. Surveyors and data folks everywhere just breathed a little bit easier. Let's do a real life example. You walk in and the tape is loose. What do you chart now?
The patient care aspect will not change. We will still use our clinical judgment to resecure tubes as needed. The documentation process will allow for improved workflow and easy identification when the ET tube was most recently resecured. You will select holder status, retaped, and then pick the reason, loose tape, and you will confirm the holder type. Let's say we just needed to retape, we would select tape again.
Boom, that's fast and clear, and later we can actually see how often this happens and why. So why should the bedside RT care? Give us the payoff.
This gives teams visibility to monitor best practice compliance and identify opportunities for improvement. We can track practice variations and trends like migration or skin issues using consistent data. For example, unplanned extubations.
And that's how respiratory leads airway safety. Data-backed, patient-centered, and real. Zach, thank you for being a guest. Any last words for the people?
Yes, this is about improving care and reducing risk, not just adding busy work.
Exactly. So when you see these new fields, remember this is us making the charting work for the patient. Track it, improve it, own it, and as always, keep breathing easy.